So this is me. Wasn't I a cute baby? Yeah. Thank you very much. So the child you see here looks happy, and I was, but what you can't see is a child who was also sick a lot. My mother tells me these stories of having to sit up with me at night just to make sure that I could breathe properly. Actually, she reminds me of it every day of my life, but anyway. What my mom didn't know at the time is that our house was making me sick. We had mice, and I'm sure mold and mildew in parts of that old house. And little Dwayne had bronchitis. And I struggled to breathe normally for many of the formative years of my life. So my truth is, my lived experience of growing up in substandard living conditions has informed my 20 plus years of work as an affordable housing advocate. I now realize that decent housing has a direct impact on the health and well-being of families, young and old. Therefore, decent housing is a social determinant of health. So I didn't even know what social determinants of health were until maybe a few years ago. I can barely say it, it's a mouthful. But I do realize that health starts at home, even though it's also affected by our schools and workplaces, our neighborhoods and communities. The conditions in which we live say a lot about why some Americans are healthier than others, and why Americans more generally are not as healthy as they could be. I mean, don't we all want to be as healthy as possible? Yes, that's a resounding yes. But the truth is, not all of us live, work, or play in environments that are conducive to good health. That's why it's important that we understand the relationship between people and the impact of places on health. And we all deserve the opportunity to make choices that lead to good health. That's why I want you to learn about social determinants of health, those conditions in the world where people are born, live, learn, work, play, worship, and age that have a whole host of impacts on our health and well-being. Now, I emphasized age for a reason, because people over 60 are especially affected by social determinants of health, especially if they are in a poverty or low-income household. I've met some of them, and many of them are living in housing that is in pretty dire straits. Homeowners like Ralph, who was wheelchair bound and couldn't move around his house. He literally could not get to his bathroom. Can you imagine not being able to go into your own bathroom? Ralph was pretty lucky. He had a nephew who was willing to stop by 2 to 3 times a day to help him toilet. But to mitigate that, strategic doorways in Ralph's home were widened, and then there was a door put directly from Ralph's bedroom to his bathroom. So now, Ralph can move around his home on his own, in his wheelchair, independently. Or Miss Carrie and her grandkids. They lived in a house that had a bad roof. It was allowing moisture to come in, creating mold and mildew situations. Everybody was being affected. Carrie was having respiratory issues and started missing work. Her granddaughter wasn't resting at night, wasn't sleeping well. So she started falling asleep in class, and she saw her grades decline. And her grandson's asthma continued to flare up. After they got a new roof and the mold and mildew was mitigated, Carrie says that everyone's health drastically improved in the house. And now, granddaughter is back on the honor roll. Or Miss Lovey. Don't you love that name, Lovey? Miss Lovey was having some mobility issues. She was starting to feel trapped in her own house because she didn't feel comfortable just stepping onto her front porch because of a fear of falling. There weren't any railings around the edge of it. But once Railings were added around the edge of the porch and along the steps down to her driveway. Miss Lovey now feels freer and safer and able to move about as much as she likes. So that's why it's important that we understand the impact of these repairs and what they can do for an older adult. They're actually keeping them healthier every day. Along with that, it's keeping them out of the ER, from having unnecessary visits or hospitalizations, maybe even early entry into nursing homes. And when that happens, that saves MCOs and insurers millions of dollars that could theoretically be redirected back to more preventative care. Wouldn't it be so cool if we could go to our doctor's office and get a prescription to mitigate an issue with our house, a deficiency with our house that then prevents a medical crisis or incident? That'd be cool. So we're all going to continue to age, right? It's happening right here while we're sitting in this auditorium. And our houses are going to continue to age. I would venture to say that there are few houses out there that were ever built that took into consideration that the homeowner was going to get older, was going to become more frail, maybe have accessibility or mobility limitations. Those are all things that can impact activities of daily living. Our ability to live out our day, do things as simple as bathing ourselves, getting up and down off of the toilet, or just walking around our house, maybe even just feeding ourselves. Things that while we're young and healthy, we might take for granted. Activities of daily living, all those things that we take for granted about moving around our house and having the ability to live out our daily lives. We don't want to take them for granted because they are the things that create our independence. And that is something that we never should take for granted. That's why innovative organizations right now, mine in particular and others, are working at the intersection of health and housing, trying to uncover unconventional investments so that we can keep investing in aging in place and seeing more older adults be able to live out their lives in the homes they love, the homes they don't want to leave behind. So you might be asking yourself, what does little Dwayne from the first photo have in common with these older adults I'm talking to you about right now? Primarily low income. That was my other truth. I grew up in a household with low incomes, with a low income. The most powerful social determinant of health is income. Think about older adults who are living at or below the poverty level. That creates way too many older adults who can't afford their medications, a healthy meal, or a healthy place to live, or even the funding to make repairs to a home. That's why innovative organizations are working, as I said, to find the dollars to invest so that more families, older adults, can remain in the homes they love for longer. And then at the end of the day, little Dwayne, who you met earlier, he did okay. He was able to reach his full potential, partially because he got out of the housing that was making him sick. So these days, I don't necessarily feel like a victim anymore. Let's see, what do I feel like? I feel sort of like a superhero. I feel sort of like a superhero, yeah, advocating for one of our most cherished and vulnerable populations. And I want to invite all of you to tap into your superhero power and do something courageous like I just did today. Thank you.